The views and opinions expressed by the guests or hosts of this program do not necessarily reflect those of Divine Mercy Radio, Incorporated.
This is the place, and now is the time where local listeners can get medical insight from a local doctor, all from a Catholic perspective. This is Doctor on Call on Catholic 540 AM, Divine Mercy Radio. If you have a non-emergency medical question you'd like to ask for a future show, email your question to info@catholic540am.org. Our Doctor on Call is Dr. Patrick O'Connell, and your host for Doctor on Call is Ellen White.
Hello, everyone, and welcome to Doctor on Call on Catholic 540 AM Divine Mercy Radio. Here we look at medical news and trends that impact all of our lives from a Catholic perspective. I'm your host, Ellen White, with our Doctor on Call, Dr. Patrick O'Connell. Dr. Pat has been practicing medicine in the Raleigh area since joining Duke Health in 2006 as a primary care physician. In 2017, he founded Sentinel Primary Care. Dr. O'Connell has a certification in Catholic healthcare ethics from the National Catholic Bioethics Center. Hello again, Dr. Pat.
Hello.
It's good to hear you and see you again.
Yes.
So even though we're still in the midst of some intense heat, the calendar tells us that we are heading into fall. Normally there's discussion around this time about the flu and flu shots, but it's especially a topic in the midst of COVID. So for this show, let's talk about flu and flu shots, and we'd also like to cover a recent study that was released by Real Clear Science about getting back to Mass safely. And finally, we'll answer some of your questions, listeners. So let's start with the flu and flu shots. What are you expecting this season? Have you seen anybody present themselves with flu-like symptoms yet?
I've seen people with COVID-like symptoms, which are largely those of the flu as well and other viruses. So way too early for flu yet. Timing's interesting, and at least in the Southeast. It may be a little different in other parts of the country, but at least here, cold season starts around Halloween, so kind of somewhere late in October. Flu season doesn't really get rolling until about New Year's. So we have all the cold viruses show up around late October as the weather cools off. We start to get a little bit of flu in November, a little bit of flu in December. But then as we get into January, it really is full-on flu season. So it's still way pretty early to be seeing influenza yet, but it'll get here.
So that's the push for getting the flu shot.
Right. So, the whole idea is get your flu shot before the flu itself gets here so that you have protection, because it takes a couple of weeks for antibodies to build up. So after you get vaccinated, it's a couple of weeks before you've got the protection that the flu shot's going to give you. So it's always the get it early or get it, before flu season is the standard mantra. Okay.
So what's your typical recommendation for that, for flu shots?
So this is an interesting question. So one is just, should I get a flu shot? To which I think, it's a good thing to do. I recommend them. I get them myself. The question I've gotten lots of this year with much more intensity than in past years is, when should I get my flu shot? I've had people call and say, do you have flu shots yet? With a little bit of urgency in their voice. And it is because of this extra drive that's out there really recommending people get flu vaccinations in the age of COVID. So I'll say two things. One is flu vaccine in the midst of the COVID pandemic. So there's nothing about the flu vaccine that's going to protect you from COVID. There's nothing about getting COVID that makes you more vulnerable to the flu. But the idea is these two illnesses can look a lot alike, and the diagnostic tests for each of them are imperfect. So when someone comes into my office and I do a nasal swab to test them for the flu, The accuracy or the sensitivity, the ability of it to detect an infection that's actually there is maybe 80%. And something similar is probably about the same for COVID testing. So whether it's the one that gets sent off to the lab for the PCR or one of the rapid antigen tests, it's probably about 70% accurate, or 70% sensitivity for detecting infection. So the issue is, if I show up to my doctor's office and I've got a fever and a cough and I don't feel good, and they swab my nose for flu and for COVID, maybe you can make the diagnosis, maybe you can't. And so if you can't make the diagnosis, now you're stuck with all the recommendations from the CDC about self-quarantine, self-isolation and all that. So big headache. So if you get vaccinated against the flu, and therefore you don't get the flu, therefore you don't get put in this quandary of like, what am I sick with? And do I need to isolate and tell everyone that I know and all that? So there's this extra layer of rationale for getting flu vaccine this season.
Well, I've heard stories about people that have gotten the flu vaccine and they've gotten the flu anyway.
Right.
So how does that play into what you're saying?
What's up with that? So there's two things to say. One is three things. One, it takes 2 weeks for the antibodies to build up after vaccination. So if you get vaccinated against the flu on Monday, and then on Tuesday, your coworker sneezes the flu onto you, you're done for. The vaccine is not going to protect you. Second, flu vaccine only protects against influenza. It does not protect against any of the other 97 viruses out there that will give you respiratory illnesses. And the stats in wintertime, in late fall and wintertime, is that something like 15% chance per week that you get sick with a cold flu kind of thing. And so that means that 15%, that's largely driven by things that are not influenza. So you're not protected at all against any of those. And the third is that the flu vaccine itself is helpful, but it's not a perfect suit of armor. The overall statistics, when you factor in years when the vaccine is a good match for the circulating strains of the flu, and then you average that in with years when there's some strain of the flu that wasn't projected and the vaccine doesn't work that well, you get about a 50 to 60% reduction in your chance of getting the flu, which means 40 to 50% of people who were going to get the flu and they got vaccinated, they get the flu anyway. Maybe it's not as bad as it would have been, but they get a breakthrough case. So the vaccine isn't perfect. So for all those reasons, there is still the potential to get sick with something, flu or otherwise, even if you've gotten vaccinated against the flu.
Gotcha. Okay. So that's very interesting. So you recommend that you get a flu shot and stay away from people that might be exhibiting symptoms and try to stay healthy during that time period. Mm-hmm. Okay, so that when you do present with other symptoms, you need to get yourself checked for the possibility of having COVID. So speaking of COVID in your office, the last time we talked, you had a couple of cases that you were treating there. How's it going now?
So there's over the course of the whole thing, roughly 6 months now since it all started, I've had maybe 5 or 6 people in the practice who I've diagnosed or they've gotten diagnosed out in urgent care. So not huge numbers, but certainly a handful of folks who have gotten sick with it. None with severe illness, thankfully. Can I add one thing real quick on flu vaccine? Sorry, one more thing. One of the other things people have asked me with extra intensity this year is when to get the flu shot. And the answer that I tell people is when it's convenient. So there's a debate over getting your flu shot as early as possible versus maybe getting it later in the fall, with the idea of protecting yourself early for an early flu outbreak versus getting it later so the antibodies carry you all the way through flu season. Nobody's done a research study to compare earlier versus later vaccination, so nobody knows what the right answer is. It's based on conjecture and speculation. There's no actual research study. So I tell people, whenever it's convenient for you to get a flu shot, that's the right time to do it.
Okay. And should you allow yourself for some time post-flu shot just in case you have some reaction to it?
Yeah, so, maybe a fourth of people that get vaccinated just feel a little off the next day, maybe a little low-grade fever, low-grade achiness. And that's your immune system responding to the vaccine. So you could view that as good. But yeah, so it's nice to know that might happen. So you're not like, oh my gosh, I have COVID. So
what would your recommendation be for those individuals that do not get flu shots? They feel like they don't need them, especially in the midst of what we're experiencing with COVID. Do you think that would be a good idea?
If you look at the statistics, your chance of not getting influenza per season is like 97% chance that you're not going to get the flu in any given year. So, I get it. If I have folks in the office, right, I lay out the story. I tell them the rationale for it. I tell them potential side effects. I tell them statistics of risk reduction and chance of the flu. And I have folks who say, thanks for the info, but I'm not going to get vaccinated. And I don't get bent out of shape. I leave it to their judgment. There's a certain risk and risk reduction, and you got to make a decision about where am I going to put my preventive effort, and do I want to get this vaccine or not? And there's lots of other factors like, am I around infants who I would really not want to give the flu to, or an elderly grandparent, or do I work in healthcare, or do I have medical conditions where it'd be really bad if I got the flu versus none of those apply? And, that's part of the calculus that people run through in their heads.
Okay, gotcha. All right. So moving on to something that we had discussed prior to this interview, with the recommendations that the churches open up across the United States. I think I read something recently that the USCCB was saying, okay, let's get back to Mass. So with that, what are some recommendations that you would have for getting back to Mass if you haven't been in a while?
So first off would be for a person who is potentially at high risk if they got infected with coronavirus and is still very antsy about being back in a public setting. If that person says, I just don't feel comfortable yet, great, that's fine. Make that decision based on the particulars of your circumstance. For the person who says, oh my gosh, it's time to go back to Mass, I need sacraments again, then by and large, the same measures that we've sort of gotten used to in all the rest of society, when applied to a Mass setting, work really well. So, I think that probably the norm in most parishes that are back to having Mass these days, I think is, every other pew is blocked off. So there's limited numbers of people inside, people wearing masks inside the church, some extra precaution around the distribution of communion. These measures work really well. So I don't think people need to view going back to Mass as a extraordinarily dangerous activity. I think really not extraordinarily dangerous. I think not any more dangerous than other things that we've built into our sort of new normal lives these days.
Yeah, and I came across and shared with you, there was an article in Real Clear Science done by 3 infectious disease experts, and they based their findings on something that was circulated by the Thomistic Institute that had said, these are the guidelines that you should follow in a Mass setting. And as a result of following those guidelines, they were very effective. And there was, and I quote from the article here, it says there was no evidence that emerged to suggest that distribution of Holy Communion in accordance with TI guidelines has led to COVID transmission. So there wasn't a single incident of transmission in Mass with somebody that had COVID to somebody that didn't have COVID. So I found that very interesting. And there's a lot of details in that article about the study itself and their findings, which is incredibly promising.
Mm-hmm. Yeah, it was very interesting. The people who put that article out are the same people, and I think some others were involved too, who had put together guidelines for dioceses on how to do Mass safely. And so they put those guidelines together based on best available science and, interestingly, with input not only from infectious disease docs, but priests, bioethicists, A very interesting group of people who put the recommendations together. And then after implementation, they said, all right, now let's see what we can find in terms of what the outcomes were. And the outcomes were very favorable. They didn't, like you said, they didn't come across instances where the whole parish got taken down. As long as people were following infection control guidelines, going to Mass was very safe. And they even detailed a handful of instances from one of the dioceses that was tracking info like this, where there were cases where the next day somebody came down with COVID, or later that day they became symptomatic and were diagnosed. So then they go back to everyone who was at that Mass and didn't come up with cases of transmission because the preventive measures were successful.
Yeah, that's fantastic news. And again, listeners, if you're interested in following up on this and reading this article yourself, you can go or just Google Real Clear Science. And the title of that article is, let me get to the top of it here, Evidence-Based Guidelines to Celebrate Mass Safely Are Working. And I highly encourage you to check it out and share it with your pastors. Okay, so jumping from flu shots to getting back to Mass safely, we've got some questions from our listeners, and it's very interesting. We talked about this just prior to the interview too. They all focus on health and how to live a healthier lifestyle in the midst of being at home more. So let's get to the first question. It says, I can't help but think that my day would be so much better if I began it the right way. What recommendations would you have?
That's wide open. Depending on you and your personality, don't start with the news. Maybe start with some prayer instead. Maybe now that the churches are opening back up, maybe some morning Mass. But I say it, but only partially, tongue in cheek. I mean, seriously, it's the from a news standpoint, it was all COVID all the time until it was now all rioting all the time, and that's the stuff that sells. And so, a little distance from the stressors is a healthy thing. Now, of course, it depends on the particulars of your life and your circumstances, dear listener. But yeah, I would say do things that are good for your mental health, spiritual health, maybe physical health. Go out for that morning walk to start the day, whatever the case may be.
Mm-hmm. Yeah. Okay. Next question. I'm really weighed down by stress in the midst of COVID, aren't we all? And all of the political upheaval. Any suggestions for lowering my stress level?
Yeah. So, like back when we were doing the interviews on COVID, one of the things that we talked about is if stress was taking on a life of its own in your life, it may be time to seek out some professional help with that, whether counseling, primary care doctor, whatever the case may be. So I would say that. If it's not stress that has a life of its own, it's just like, these are stressful times, which they are. Then good self-protective measures like getting routine exercise and insofar as appropriate to your health circumstances. Exercise is a great way to take all that stress energy and do something with it. There's a therapeutic value to taking a weight and going rah and moving it. That has value to it. Well, when it's issues that are within our control, acting so that you take it under control is helpful. For issues that are bigger than us, maybe acting in a way that actively entrusts it to God and to his protection is helpful. So not just prayer like, oh God, make this go away, but no, Lord, I'm fasting for the good of our society today. I offer this to you. That's an act. That's an action for the good of other people who are suffering from the distress from all that's going on. So these are a couple of ideas.
I think intermittent fasting might be a good topic for another show.
Health benefits.
And that's a great segue, starting an exercise program. That's one of the next questions. So I'm not much for exercise, but with all of this extra time working from home, I'd like to start one. What do you recommend? Where should I start?
Yeah, great question. So the general advice that I give folks in the office when I'm talking about starting exercise is what I would say here. So, first off, make sure it's medically appropriate and, you're not putting yourself in medical danger, but assuming that's not an issue. So the handful of suggestions I give folks, one is if you've not been a regular exerciser for a while, go slow. Because, gosh, you hate in like week number 2, you pull your hamstring and then you're out for a month and then you never get back to it again. So take your time. Ease into it. You don't need to go to the Olympics next year, so there's no need to be super aggressive in pushing a training regimen. Second thing I suggest to folks from an exercise standpoint is try to find stuff you like, or at the very least, avoid stuff you hate. If a cardiologist said to me, look, if you don't get on the treadmill for 45 minutes a day, you're going to have to take this cholesterol medicine, I would say, give me the cholesterol medicine. Thank you very much. I'm not getting on a treadmill. Versus if they said, I don't know, hey, you have to go ride a mountain bike on trails for 45 minutes a day. Okay, awesome. I'll go do that. So the idea is if there's a particular exercise that you just loathe doing it, don't do it. Find something else. So find exercise that's enjoyable on its own merits, because then it's easier to keep it going. It's easier to build it into your routine. It's fun. It's restorative to kind of your mental energy. So find stuff you like. And then third is depending on kind of your motivations, you might choose some goals for yourself, because if it's just kind of going out in the garage and lifting some weights, like, okay, fine. But if you're like, no, I want to, by next winter, I want to run a 5K in less than some time. Okay, now you have a goal. So if that motivates you, maybe you choose a specific goal to build to so that it helps keep you on target.
That's great. And I've always heard, if you're not much for exercise, if you just get up and walk to your mailbox the first day and then walk just a little bit beyond that. Yeah. And I have been I'm a runner, and I've said this before, but I don't plug in. I listen outside. It's much more effective for me instead of, listening to music or, just shutting off the world. I like to be present. So that's enjoyable for me. Okay. So I started to go with this question, but I think that we'll switch it up a bit so that we're not ending with this one. This question has to do with COVID. There's been some discussion about immunities and our body's ability to fight COVID. Do you believe that someone with the same makeup physically as someone else, but with different immunities, is able to fight COVID better?
Yeah, that's a sensible question. One of the risk factors for having a bad go of it with COVID is if your immune system just doesn't work that well. So a person whose immune system is robust and healthy versus a person whose immune system is limping along, the person with a lesser immune system is at higher risk of complications, which is, that's a theme in infections and medical care. So, the person who is going through chemotherapy, for example, and as a consequence, their immune system's getting slapped every week or 2 weeks with chemotherapy, that person's infection risk is higher versus once they get done with chemotherapy and then their white blood cell count rebounds and their immunity rebounds. So the same kind of theme would carry through to COVID as well.
Gotcha. Okay. And finally, what are some healthy habits for managing stress and anxiety? I'm telling you, this is a theme. Yep.
So if the source of stress is something you can fix, attack the problem, fix it. But a lot of times it's not. I reckon that's an easy one. I probably wouldn't be asking the question if that were doable. Second is when the stress is going to be there and it's going to be there in a sustained kind of way, finding an escape from it. So find something pleasant to do that recharges your battery so that you can get back into the fray dealing with the source of your stress. So taking breaks. Third, like we mentioned earlier, exercise can be useful because that stress energy that builds up, if you can channel it into exercise, a lot of people find that very helpful for their state of mind. If anxiety is problematic and it is spilling over into other parts of life and the person just feels continually wound up and on edge, there may be something more that has developed with the anxiety where it has taken on momentum of its own, and that may warrant some professional input on best measures.
Yeah, there's definitely been a lot of reports of increased anxiety and depression in the midst of what we're experiencing. So yeah, definitely seek professional help if you've reached a level where you can't get away from it for a bit. So thank you for that. Do you have any final thoughts as we wrap up here?
Nothing big. I mean, I would say knowing that cold season's coming and every time somebody sniffles, it's like, oh my gosh, here we go. It's COVID. Enjoy the warm weather.
Yeah. And don't freak out when somebody's sneezing around you.
Right.
Okay. So again, listeners, if you would like to tap into that article that we talked about earlier from Real Clear Science, you can simply Google evidence-based guidelines to celebrate masks safely are working. And Dr. O'Connell, where can our listeners go to find you?
Yes. So my practice is Sentinel Primary Care. So sentinelprimarycare.com is the practice website, or you can just Google my name, Patrick O'Connell, Raleigh, and I'll come up.
That's it for this episode of Doctor on Call on Catholic 540 AM Divine Mercy Radio. Our thanks to Dr. Pat for sharing his insights with us today. We want to remind all of our listeners that if you have a non-emergency medical question that you would like Dr. Pat to address on a future show, simply email us at info@catholic540am.org. That's info@catholic540am.org. If you missed any part of today's program, you can play our past local shows by going to catholic540am.org and click on local programs. The executive director of Catholic 540 AM Divine Mercy Radio is Cecilia Flannery. Our director of programming is Peter K. O'Connell. Our engineer is Keith Flannery. With Dr. Patrick O'Connell, I'm Ellen White. Thank you for listening. Stay healthy and may God bless you.